At 2:16 a.m., Richard sat up in bed, gasping quietly. His mouth was so dry it felt like he'd been breathing desert air. His shirt clung to his back with sweat, and as he swung his legs over the edge of the bed, he noticed something else. His feet felt distant, numb, as if they didn't belong to him. He rubbed them for a moment, unsure if it was just another restless night. But this wasn't the first time. It was the fourth night this week he'd woken up like this. Richard is 69. He's never been diagnosed with diabetes. He walks every day, tries to eat well, and only sees the doctor once a year. But lately, his nights have been changing. He's noticed strange dreams, dryness in his mouth, a tightness in his chest that comes and goes, little things that don't seem serious until they all start happening at once. I'm Dr. Jonathan. For over 25 years, I've helped older adults like Richard recognize the early signs of diabetes, especially the ones that appear when no one's looking, in the middle of the night. Because the truth is, some of the most dangerous clues don't show up during the day. They hide in your sleep, quiet but persistent, subtle but serious. In the next few minutes, I'll reveal 15 nighttime warning signs that no senior should ignore. And we begin with one of the earliest and driest signals your body might already be sending. You wake up, and it feels like your tongue is glued to the roof of your mouth. Your lips are dry, your throat scratchy and burning. You reach for the glass of water on your nightstand. Again. Maybe this is the third time tonight, or the fifth this week. Many seniors assume it's just the heater, or maybe they didn't drink enough water before bed. But what most don't realize is that dry mouth at night is often one of the earliest signs of high blood sugar. When glucose builds up in your bloodstream, your kidneys work overtime to flush it out. But in doing so, they also pull extra water from your tissues, leading to dehydration, especially at night. That dry cotton-mouth sensation is more than a nuisance. It's your body asking for help. Left unchecked, this constant fluid loss can strain your kidneys and thicken your blood, making circulation harder and increasing your risk for complications. And if you're drinking more water to quench that thirst, your nights might soon be disrupted by something even more frustrating: repeated trips to the bathroom that leave you more tired than before you went to bed. You shuffle your feet across the floor, half asleep, making your way to the bathroom, again. The clock says 3:12 a.m. You were just there at 1:40, and before that, it was 11:30. You're not sleeping through the night anymore. You're sleeping between bathroom visits. It's easy to blame age or a small bladder, but this pattern, called nocturia, is a major red flag, especially for older adults with rising blood sugar. Here's what happens. When glucose builds up in your bloodstream, your kidneys attempt to flush the excess sugar out through urine. But that sugar draws water with it. More sugar means more urine. More urine means more bathroom trips. And more bathroom trips mean less deep sleep, more fatigue, and a body that never quite recovers. If you find yourself waking 2, 3, even 4 times a night to urinate, your kidneys may be under chronic stress, struggling to keep up with a sugar overload they were never built to handle. And over time, this pressure doesn't just affect your bladder. It affects your nerves too. In fact, one of the next warning signs you might feel doesn't come from inside your body, but rather across the surface of your skin, in the form of sweat. You wake up drenched, your pillow is damp, the sheets are clinging to your back, and yet the room isn't warm. The fan is still on. There's no fever, no nightmare, just an overwhelming sense of heat, followed by confusion. For many seniors, this kind of unexplained night sweating can be one of the earliest signs of nocturnal hypoglycemia, low blood sugar during sleep. And while it may seem harmless, it's a signal that your body is in distress. When your blood sugar drops too low at night, your body sounds the alarm by releasing adrenaline and cortisol, stress hormones meant to wake you up and correct the imbalance. These hormones raise your heart rate, trigger sweat glands, and flood your system with a jolt of energy that feels more like panic than relief. The result? You wake up soaked, jittery, and often confused about what just happened. If this continues night after night, it can disrupt your sleep cycle, exhaust your adrenal system, and push your body into deeper imbalance. But while sweating may jolt you out of sleep, the next symptom might keep you from falling asleep at all: especially when it starts in your legs and refuses to stop. You lie down, hoping for rest, but your legs have other plans. There's a strange crawling sensation deep in your calves, a buzzing, a tension that builds and builds until you can't ignore it anymore. You shift your legs, stretch your toes, kick the blankets off, but the feeling doesn't stop. It only fades until it comes back stronger. This is restless leg syndrome, RLS, and while it may sound like a minor nuisance, it can be an early sign of diabetic nerve damage. When blood sugar remains elevated over time, it begins to damage the small nerves, especially those in the lower limbs. These nerves misfire at night, creating odd sensations and irresistible urges to move. The result? Fragmented sleep, chronic fatigue, and increasing frustration. RLS not only steals your rest but may also be a preview of deeper neuropathy, the kind that leads to loss of sensation, pain, and imbalance. If your legs won't let you sleep, it's time to listen. Because what begins as a small twitch may be your nerves warning you that something much bigger is shifting. And for some seniors, that warning starts not with their legs, but with their vision, when even the dim light of night becomes too much to bear. You wake up needing to use the bathroom. You flip on the hallway light, but everything looks off. The light feels too bright, but the edges of objects are soft. The floor seems farther away than usual. You squint, blink, rub your eyes, but the blur remains. Blurry vision at night is more than just a sign of aging. It may be an early symptom of blood sugar-related eye strain, particularly from rising glucose levels overnight. High blood sugar causes fluid to shift in and out of the lenses in your eyes, distorting their shape and flexibility. This temporary swelling changes how your eyes focus, especially in low light. It becomes harder to judge distance, detect contrast, or adjust between light and dark. Over time, this leads to diabetic retinopathy, a condition where delicate blood vessels in the retina begin to leak or close off, leading to permanent vision loss. If your night vision is fading, don't wait for it to affect your days. It's your eyes telling you they're under stress. And while vision problems might fade with the morning sun, the next sign of trouble doesn't disappear so easily. In fact, it may still be there when you wake up. A heavy, unshakable fatigue, even after what seemed like a full night's sleep. You went to bed at a reasonable hour. You avoided caffeine. You didn't wake up during the night, or at least you don't think you did. But somehow when morning comes, it feels like you haven't slept at all. Your body is heavy. Your thoughts are foggy. It's like waking up with the weight of sleep still pressing down on you. This isn't just poor rest. It may be a hidden effect of blood sugar imbalance. When glucose levels fluctuate overnight, either rising too high or dropping too low, your body spends the night working to correct the problem rather than restoring itself. Sleep becomes shallow. Dream cycles are broken. Recovery never happens. In people with early or unmanaged diabetes, this becomes a silent cycle, tired all day, restless all night, and energy that never quite returns. Even worse, this ongoing exhaustion leads to higher cortisol levels, increased appetite, poor focus, and less motivation to move, all of which further elevate blood sugar. It becomes a loop that wears you down slowly, night after night. But sometimes the exhaustion isn't the worst part. For many seniors, the next sign is far more disturbing. A strange, burning heat that starts deep in the feet and refuses to go away. You slip under the covers, hoping for rest. But within minutes, a deep warmth starts building in your feet. Not a comforting heat, but a prickling, burning sensation that feels like you're standing on hot pavement. You kick off the blankets, shift positions, even dangle your feet off the bed. But the discomfort lingers. Sometimes it feels like tingling, other times like tiny electric shocks, and it always seems to get worse at night. This isn't poor circulation or just old age. It's a classic sign of diabetic neuropathy, nerve damage caused by long-term elevated blood sugar. The nerves in your feet are among the smallest and farthest from your heart. That makes them the first to suffer when glucose damages tiny blood vessels and interrupts oxygen supply. At night, when your body is at rest, those damaged nerves can misfire, sending confusing signals to your brain. Left untreated, this burning may progress to numbness, and eventually to complete loss of sensation, a dangerous condition that makes it easy to miss injuries, ulcers, or infections. Your nerves are not just uncomfortable, they're calling out for help. And just as nerves can become overactive, so can your heart. The next sign isn't felt in your feet, but deep in your chest as it races to catch up with what your blood sugar is doing in the dark. You're lying still, trying to fall asleep, when suddenly, your chest flutters. A deep thump, then a racing beat. It feels like your heart is skipping, flipping, pounding against your ribs. You sit up, you breathe deeply, it settles. But minutes later, it happens again. No chest pain, no anxiety, just a heart that won't stay quiet. These nighttime palpitations can be unnerving, but they're not random. Blood sugar swings, especially drops during sleep, can trigger a surge in adrenaline, your body's fight-or-flight hormone. This sudden rush is meant to jolt your system back into balance, but it comes with a cost: rapid heartbeat, a sense of urgency, and disrupted sleep. For seniors, repeated episodes of this kind may indicate not just poor glucose control, but also autonomic nervous system dysfunction, a common complication of long-term diabetes. Worse, these irregular nighttime heartbeats can increase your risk of serious heart events if left unaddressed, especially when combined with high blood pressure or cholesterol. If your heart is speaking in the middle of the night, don't ignore it, because it's often paired with another strange signal, one that doesn't come from your chest or your feet, but from deep within your dreams. You're running from something, or falling, or trapped in a strange, vivid place you've never seen before. You wake up breathless, confused, and shaken. It takes a few seconds to remember where you are. These dreams don't feel like dreams at all. They feel real. Too real. While most people associate nightmares with stress or medications, these intense dream states, especially when they happen often, can also be tied to blood sugar instability during REM sleep. Your brain needs a stable supply of glucose while you sleep, especially during the dream-heavy REM stage. But when blood sugar drops too low or spikes too high, your brain reacts by producing disorganized signals. The result? Vivid, surreal, and often disturbing dreams that can jolt you awake. Over time, disrupted REM sleep leads to poor memory consolidation, low mood, and increased anxiety. And these dreams may be a sign that your brain is no longer operating on steady fuel. The mind doesn't lie, and when it starts crying out in your sleep, it may be because your blood sugar is failing to keep up. But not every warning comes from deep inside the brain. Some signs are simpler, felt in your fingertips and toes. The next one is easy to overlook, until you realize what you can no longer feel. You reach down to pull your sheet, but your toes feel missing. Not in pain, not sore, just strangely absent. You press them into the mattress and realize they're there, but you can barely feel it. This isn't poor circulation from sleeping in the wrong position. It's the quiet onset of diabetic peripheral neuropathy, nerve damage that begins in the smallest extremities. High blood sugar over time wears down the tiny blood vessels that feed your nerves. Without that blood supply, nerves misfire, or stop working altogether. What starts as a little tingling or numbness eventually becomes permanent loss of sensation. For many seniors, this numbness comes at night when they're still, and the body's signals are easier to notice. But here's the danger. When you can't feel, you can't protect yourself. Small cuts go unnoticed. Pressure builds on the soles of your feet. Infections develop without warning. And that's how diabetic ulcers, and in worst cases, amputations, begin. Your body should feel like it belongs to you. When it doesn't, it's time to act. And sometimes, before the numbness sets in, there's something even more jarring. Something that snaps you awake in pain. A sharp, sudden cramp in your leg that feels like it came out of nowhere. You're deep in sleep when it hits. Sharp, twisting pain in your calf. It tightens like a knot, pulling the muscle into a cramp so intense it takes your breath away. You grab at your leg, try to stretch, massage, anything to make it stop. Eventually, it eases. But now you're wide awake, heart racing, wondering what caused it. Nighttime leg cramps and twitches aren't just inconvenient. They're a red flag, especially for seniors managing or approaching diabetes. High blood sugar causes the kidneys to excrete more than just excess glucose. It also flushes out critical electrolytes like magnesium, potassium, and calcium. minerals that keep your muscles relaxed and balanced. Without them, your nerves become hypersensitive. Your muscles misfire, and your body seizes, sometimes literally. These cramps are more than just painful. They interrupt your sleep, raise your stress hormones, and increase your fall risk if you try to stand or walk afterward. Over time, they chip away at your strength and confidence. If pain is waking you before the morning does, it may be your body screaming for support. And while these cramps feel like chaos, the next sign is often loud in a different way, one you might not even notice yourself. But your partner surely will. You may not hear it, but your partner does. A deep rumbling snore, then silence, then a sudden gasp like your body is trying to catch something it lost. This happens again and again, until you jolt awake, confused, your heart pounding. This isn't just snoring, it's sleep apnea, a condition where your airway closes repeatedly during sleep, cutting off your oxygen supply. For seniors, especially those with prediabetes or diabetes, sleep apnea is more than a nuisance. It's a metabolic disruptor. Each episode triggers a surge of cortisol and adrenaline, stress hormones that drive insulin resistance, raise blood sugar, and strain your heart. And because sleep apnea fragments your deep rest, it prevents your body from healing. You wake up exhausted, your blood sugar elevated, and your nerves on edge. Over time, this leads to weight gain, memory loss, high blood pressure, and worsening glucose control. Many people with sleep apnea don't even know they have it, but their nights tell the truth, and their days pay the price. If you've been told you snore, or if you wake up with headaches, dry mouth, or a racing heart, it's time to ask deeper questions. Because sometimes it's not your breathing that keeps you awake, but your brain refusing to slow down. And that leads us to the next hidden sign. The room is quiet, the lights are off, but your mind, it won't stop. You toss, turn, stare at the ceiling. Thoughts bounce around, what you forgot to do today, what might happen tomorrow, and that odd tightness in your chest that keeps returning. Hours pass, sleep doesn't come. For many seniors, insomnia feels like a natural part of aging. But what they don't realize is that unstable blood sugar plays a major role in disrupting the brain's ability to power down. When your glucose levels swing at night, especially if they drop, your brain perceives it as an emergency. Stress hormones like cortisol surge, triggering mental overactivity, anxiety, and alertness. Even if your body is tired, your brain won't allow sleep. And chronic insomnia creates a damaging cycle: less sleep, more insulin resistance, worse blood sugar, even less sleep. Over time, this leads to mood swings, memory lapses, depression, and a weaker immune system. If you find yourself lying awake night after night with thoughts that won't settle, it's time to ask, is your brain reacting to something deeper? And while your mind may race in the dark, your body may be reacting too, in quieter ways. Like the chill in your hands or feet. Even when the room isn't cold at all. You're wrapped in blankets, the room is warm, but your fingers feel icy, your toes, like little blocks of cold clay. You rub them together under the covers, but the warmth doesn't come. This isn't just poor circulation, it's a warning from your blood vessels. Chronically elevated blood sugar damages the lining of your arteries and narrows them over time. As these vessels stiffen and constrict, less blood reaches your hands and feet, especially when you're lying still. At night, this becomes more noticeable. Your body isn't moving, your heart rate slows. And those small capillaries that are already struggling simply can't deliver enough warmth. Cold extremities might seem harmless, but they're an early sign of vascular stress, and when ignored, they can lead to delayed wound healing, infections, even tissue breakdown in people with diabetes. Your body is designed to keep itself warm. If it can't, it's trying to tell you something. And while this chill might feel physical, the final sign we'll talk about tonight begins deeper. It isn't about pain, or numbness, or sweat. It's about hunger, a sudden, desperate hunger that pulls you from sleep, demanding something sweet. You're pulled out of sleep by a hollow ache in your belly. It's not just mild hunger, it's urgent. You feel shaky, weak, maybe even a little dizzy. You find yourself standing in the kitchen in the dark, reaching for something, anything, with sugar. It might seem harmless, a quick bite, a midnight snack. But this habit, especially if it happens often, may point to nocturnal hypoglycemia, a dangerous drop in blood sugar during the night. When glucose levels fall too low, your body responds with an emergency signal, intense hunger. It's the fastest way to get your sugar back up. But the cycle this creates, sugar crash, panic hunger, quick carbs, can destroy blood sugar stability over time. Waking up with the need to eat shouldn't be normal, and yet many seniors dismiss it. They blame light dinners, stress, or habit. But if you regularly feel the need to eat during the night, or wake up drenched in sweat and starving, it's time to check your blood sugar. This is your body asking, sometimes begging for help. And if you've noticed any of these signs, not just one, but 2, 3, maybe more, then don't brush them off. Because the silence of night is when diabetes speaks the loudest. If you've noticed 1 or 2 of these signs, you might think they're no big deal. After all, who hasn't had a dry mouth or a strange dream once in a while? But here's the truth. When these signs begin to stack up, they don't just point to a bad night's sleep. They reveal a body that's struggling to stay balanced in silence, often without your awareness. Dry mouth, frequent urination, numb toes, racing heart, cold feet. None of these are random. They're early warnings that your blood sugar may be fluctuating dangerously while you sleep, and they often appear months or even years before a diagnosis is made. You see, diabetes doesn't always knock loudly. Sometimes it slips in through the cracks, whispering in the night, hoping you won't notice. But now you know what to listen for. If you've experienced 3 or more of these signs, especially in the last few weeks or months, please speak to your doctor. Request a fasting blood sugar or A1C test. Start keeping track of your sleep and symptoms. And above all, don't wait. The sooner you act, the more power you have to protect your nerves, your eyes, your heart, and your future. I'm Dr. Jonathan. For over 25 years, I've helped seniors reverse the early damage of blood sugar problems, not with fear, but with knowledge, compassion, and consistency. And now, I'm inviting you to do the same. Share this video with someone you love. Subscribe for more science-based, heart-led guidance. And tonight, before you sleep, listen to your body. It may already be speaking in the only way it knows how.